everyone, and welcome to Reducing TCPA Risk in Outbound Healthcare Communications, presented by Neustar. I'm Leslie Small, editor of Fierce Health Payer, and I'll be moderating this webinar. Our speakers today are Becky Burr, Chief Privacy Officer and Deputy General Counsel for Neustar, Mark Brennan, a partner at Hogan Lovells LLP, and Adam Russell, Executive Director of Compliance Risk and Fraud for Neustar. You can read their full bios on the right side of your window. Just a few technical notes before we begin. If you have trouble reading a slide, please hold and drag the right corner of the slide window to enlarge. Please also disable your pop-up blocker to participate in the interactive parts of this presentation. If you'd like to download the slide deck, please click the download slide widgets at the bottom of your screen. The webinar is being recorded and will be available on demand within 24 hours after the event. We'll follow the presentations by a Q&A session. Please submit your questions during or after the presentations using the Q&A box at the right of your window. All right, now let's begin. Adam, please go ahead.
Hi, everyone, and thank you for joining the webinar today. I just want to take us through a quick list of the agenda, and then I will pass it over to Becky to get us started. So in today's webinar, we're going to cover a number of different topics related to TCPA. We're going to start out with the current TCPA environment. We're going to discuss the legal aspects of TCPA regulations and the impacts of last year's declaratory order, provide an explanation of why reassigned phone numbers pose risk, as well as a summation of the consent requirements for contacting consumers, a description of the one-call exemption, a discussion on the special exemptions for healthcare providers, and then I'll be back at the end to share some recommendations for implementing steps to mitigate TCPA risk and to improve operations. Becky, I'll pass it over to you.
Thank you very much, Adam, and welcome. Good afternoon, everybody. You're on the call, so you probably know why you should care about TCPA compliance. But we're going to provide a little bit of background and then get as quickly as we can into the substance. Companies who call or text consumers obviously need to comply with the Telemarketing Consumer Protection Act. The FCC reports and repeatedly reports that these are the #1 complaints to the FCC over anything at all. The FCC has acted in the past several years to increase enforcement and to clarify TCPA in ways that are generally shift the burden to those who make calls or outgoing calls or texts. And the environment is heavily litigious in this environment. That is largely because the TCPA includes statutory damages, so somebody who's suing does not need to show that they've been harmed in any way, and the minimum damage of $500 per event, so per text or per call, and $1,500, up to $1,500 per text or call. That brings the price tag up pretty quickly, and that also makes TCPA litigation very attractive to plaintiffs' attorneys who can receive statutory damages. So the world is getting much more litigious than it has ever been in this regard, and lawsuits are increasing pretty dramatically, as you can see from the year-over-year increases that we're seeing. So the bottom line is you don't want to be on the receiving end of one of these lawsuits because they are costly even just to settle, and certainly extremely costly to litigate. And of course, the FCC, the Federal Communications Commission, which implements and enforces TCPA, also has authority to bring regulatory enforcement actions where the civil penalties for violations are likewise extraordinarily stiff. bottom line, very quick bottom line on TCPA. It was enacted in 1991 to restrict telemarketing calls, pre-recorded voice messages, and the use of automated telephone dialing systems. If you, just to put this in context, recall in 1991, wireless devices were big. They were not ubiquitous, but also it was quite expensive to receive a call to that device in 1991. And the Congress thought, one, consumers should not be required to pay for calls that they don't want in the first instance, and two, because of automated dialing equipment that had the ability to, for example, call sequentially every single number in a hospital system or something like that, that there could be some public safety issues associated with those kind of random or sequential, particularly sequential systems, dialing systems. So the bottom line is that you can't auto dial or use pre-recorded voice messaging to mobile devices without the consent of the subscriber or customary user. You can auto dial, but you cannot use pre-recorded voice messaging to landlines without consent. And the onus of demonstrating that you have the requisite kind of consent will be on the party making the call or sending the text. And we'll talk a little bit about what requisite consent means in any particular context. Now, with all of this litigation going on, it's not surprising that many businesses petitioned the FCC to provide some clarity, particularly to provide some clarity regarding what kind of equipment was encompassed by the term automated telephone dialing system, and also to provide some clarity on what happens in the context of reassigned numbers or numbers on family plans, for example. And in February of last year, or I'm sorry, July of 2015, the FCC issued a declaratory ruling and order settling several dozen of the requests for ruling. And unfortunately, the declaratory ruling and order did not contain much by way of relief for businesses. The FCC noted that robocalls, both telemarketing and informational, continue to be the biggest source of complaints that they receive, and that they thought that it was in their authority and their obligation to empower consumers to decide to have more voice in which robocalls and text messages they receive. So it was a bit of a disappointment for reasons that we will talk about as we go through here. Now, there were a couple of key points in the FCC's 2015 declaratory ruling, and I'd like to turn to Mark to walk us through those key points.
Thanks, Becky. And as discussed and shown on the slide, there are several issues that really stood out. This declaratory ruling covered more than 20 different separate petitions for clarification or other type of decision from the FCC, and this is just a sampling of some of the issues that are covered in this decision, but are some of the most important ones from a compliance perspective. So the first one, the definition of called party. As Becky mentioned, there are several provisions in the TCPA that require a caller to obtain prior express consent before placing certain calls. The full statutory language requires prior express consent of the called party, and called party is not defined by the TCPA, and there was a lot of confusion and disagreement as to what called party meant, particularly in the context of when a telephone number is reassigned from one subscriber to another. For example, if I have a certain telephone number and then I cancel my wireless plan and get a new telephone number, well, that old telephone number becomes available for others to have and is reused by the carrier or a different carrier to make available for other consumers and businesses. And so this concept of what happens in the reassigned numbers context was something that was teed up for the FCC, and many callers had mentioned that their argument was that the called party should be interpreted as the intended recipient of the call. In other words, whichever individual you were trying to reach at the telephone number is the person that should matter for purposes of consent. And others had said, no, the called party has to be the current subscriber. And that's the decision that the FCC went with. They said that the called party, for purposes of obtaining consent, is the current subscriber or owner of that line, or the customary user. And what that means as a result for your compliance and implementation approaches, that you may be doing everything that you're supposed to be doing under the TCPA, and you could still have risk if you're not careful and take steps to maintain up-to-date information. So for example, if you are obtaining consent, and there's no dispute about the consent, to call a specific person at a specific telephone number, under most circumstances that would be sufficient for purposes of your TCPA compliance. However, if at the time you place your call that number has been reassigned to a new subscriber, the question arises as to whether you'd have consent for the new subscriber, and the FCC said you don't. So you need to take steps to make sure that your calling information, your customer profiles, your databases, etc., are kept up to date, and also that you look for methods to verify that the subscriber, account holder, patient, or other information that you have on file, it remains accurate, and that the phone numbers and other data is verified at the time you place the call. So that's the called party and reassigned numbers issue, and we'll come back to that in a moment. On revocation of consent, the FCC confirmed that under the TCPA, the call recipient has the right to provide prior express consent and may revoke that consent at any time through any reasonable means. So the fact that you've obtained prior express consent doesn't mean that it is something that is unchanging or cannot be modified or revoked over time. Instead, you have to have prior express consent by the time you place a call, and if a consumer revokes the consent, again, through any reasonable means, that's how the FCC clarified it, you no longer have the consent to place the call, because you'd have to seek a new consent down the road. So prior express consent matters in terms of at the beginning of the relationship and throughout the relationship. You have to maintain and be able to demonstrate that the consent remained active for all of the calls that you make. Third, and one of the most controversial parts of the decision, the definition of an auto dialer, the FCC took an increasingly expansive view of the auto dialer definition in the statute, and it said that you look not only to the ability and the capabilities of the technology at the time you are placing the call, but also to what what ability it could have, even if certain modifications may be needed. So you look not just, the operative word in the definition is capacity, and you look not only to what the technology or what your calling solution can do at the time of the call, but also that what it could do with some modifications. Now, start with the premise that the FCC said the only solution that the FCC gave, the only example they gave of a type of technology, and using the term loosely, that was not potentially an auto dialer was rotary phone dialing. And that's really a big shift from where the FCC's prior language had been and where courts had been on the meaning of an auto dialer. Before this order, there had been a prevailing view that as long as there was some amount of human intervention involved in the placing of a call, one touch, one click dialing, 10-digit dialing, and the different variations that are out there, that was sufficiently safe to avoid having the equipment be viewed as an auto dialer and avoid triggering the consent requirement. In this order, the FCC essentially made human intervention a necessary but not sufficient means of avoiding the auto dialer definition. They said that the basic function is that it has the ability to dial a lot of numbers quickly without human intervention. But again, you have to look not only to what the equipment can do at the time of the call, but what it could do with some modifications, which raises a number of questions across different technologies regarding the different modes that may be available at the time of the call, the ease or difficulty with which the user can select among different modes. In cloud solutions, sometimes it's difficult to change modes, or the user, the client may not have sufficient access to different calling approaches. But to give a specific example, if the calling technology you're using has several different modes, such as predictive dialing, preview dialing, and other modes, well, historically, there had been greater risks with predictive dialing. And this order also, by the way, clarified that predictive dialers are auto dialers. But the question comes up, what happens if your solution allows for predictive dialing, but you instead place the calls in preview mode? And now, under this order, there are additional risks that plaintiffs can argue that the solution you're using is an auto dialer, even if you're currently placing the calls in preview dialing mode, and so on and so forth. So again, the only safe harbor, so to speak, that the FCC provided was for rotary phones. And I will tell you, we have seen a significant uptick, not just in the overall litigation on the point of auto dialer and having the plaintiffs take expansive readings, but it's also become more difficult to have the cases dismissed voluntarily whenever there is some integration between the telephone or telephone software and the calling database. So at that point, the plaintiff's bar has started to take the position that once you're somewhat integrated between the list of numbers to be called, or your call database, and the telephone, so integrating the telephone with the computer, basically, that they're taking a position that any level of integration is sufficient to at least get past the pleading stage, and that's become a major headache for parties in this space. The FCC,
and Mark, let me just interrupt one, just to point out, the reason, of course, is once you get past the pleading stage, you're into discovery, and so the courts are reasoning that plaintiffs should at least be able to do discovery to determine whether or not there was actually auto-dialing equipment in place. And of course, at that point, the litigation becomes exponentially more expensive.
That's exactly right. For many of the plaintiffs' attorneys, the cases may be taken on contingency, so the overall strategy seems to be to make it as painful for the defendants as quickly as possible. And one of the challenges for the defense side is if the case cannot be dismissed or dealt with quickly at the early pleading stage, you're essentially forced into the expensive and time-consuming discovery phase, and that's where plaintiffs have used that lever to really pressure for a settlement or for a higher value settlement. Mm-hmm. The FCC also adopted several limited carve-outs from these consent requirements, specifically the requirement that requires prior express consent for auto-dialed or pre-recorded non-marketing calls and text messages to wireless telephone numbers. These we'll discuss the healthcare treatment exemption a little bit later, But in short, these are the FCC has authority to create an exemption for calls that are free to the end user or that otherwise don't impose any charges on the end user. So if you work out an arrangement with the carrier and qualify for one of these exemptions, there's some flexibility to avoid some of the headaches that we've been talking about with called party, consent revocation, and auto dialer. One of the notable ones from this order was for certain financial services calls, such as data breach alerts and identity theft and fraud protection notifications. Going back to the reassigned numbers issue, the FCC, as I mentioned, clarified that it's the current subscriber or customary user for which you have to obtain consent. They did, however, provide a one call or one call attempt exemption, where if as long as you have a good faith prior express consent argument to be placing calls to a person at that specific number and you're not otherwise aware of the reassignment, then your very first call after the reassignment does not subject you to liability. However, importantly, it's only a call attempt. So regardless of whether the new subscriber answers the phone or it goes to voicemail or you have any actual conversation, you get one call attempt. After that, the FCC clarified strict liability to the caller. And then finally, the FCC has indicated in the past that SMS text messages qualify as calls, and there were some questions regarding the extent to which the rules applied to text messages. In other words, are they always treated like calls and like voice calls? And the FCC essentially took the position that text messages, SMS text messages, and other platforms can qualify as calls and should be treated as calls, just like voice calls, and subject to the same consent and revocation requirements. With that, Becky, I think that takes us to the reassigned numbers issue. This decision has been appealed, and it is currently pending review by the D.C. Circuit.
And do we have any sense of timing on that appeal at all, Mark?
The D.C. Circuit historically has wrapped up decisions on its docket by August of the relevant year. So we've not seen a scheduling order for oral arguments. The pleadings have already been filed, briefs have already been filed. We've not seen a scheduling order for oral arguments, but our expectation is that sometime between now and August of this year, we'll have a decision. And the big issues teed up in that appeal are the auto dialer issue, reassigned numbers, consent revocation, and then certain nuances with how the FCC has treated healthcare calls.
Thanks.
And we'll talk about those in a bit.
So stay tuned on that. So just briefly to recap, the reassigned numbers issue, it does pose a risk because the FCC clarified that you are required to have the consent of the subscriber or the customary user, for example, in the event it is a phone that's part of a family plan. And that if that phone number is reassigned to another party, then the consent that you have to dial that number is no longer valid. And as we are seeing, particularly in dense urban areas where the demand for numbers is very high, phone numbers that are returned to the telephone carriers are being reassigned quite promptly. In which case, you will no longer have the consent of the subscriber, the party that is picking up the telephone, and therefore you have a TCPA violation. The FCC, frankly, recognized that there is no silver bullet to solve this problem, but they sort of split the baby in a sense with this one free dial, basically saying after you dial that number the first time after it's been reassigned, which you may or may not know, then you're strictly liable. And they said, there are several industry best practices that you can follow that over time will help you understand whether a number's been reassigned. We acknowledge and understand that that's really no guarantee, but we think on balance we're going to err on the side of protecting consumers from unwanted calls in this case. Now, if we could just talk a little bit about consent, because there are the statute and the rule requires prior express consent to auto dial or send pre-recorded messages to wireless and to send pre-recorded messages to landline. And the consent as of 2013 depends in part on what the context is. So the FCC has maintained a notion that if somebody gives you a telephone number in response, a mobile number, for example, in response to, what is the best number to reach you in connection with this application or whatever, that you can infer from the fact that they have given you a mobile number the notion that they have consented and agreed to receive auto-dialed calls at that wireless number to the extent that you have described the purpose of your call. But if you are making a call that contains marketing messages, you must have the prior express written consent of the called party or customary user. In that case, the FCC was simply adopting the standard that the Federal Trade Commission uses in the telemarketing sales rule, do not call list context. And by written consent, that essentially means that you have to be able to capture and demonstrate that you have that consent. For example, it need not be in writing with pen and ink or quill, but it could be a audio consent that is recorded, or a check the box in an online form or the like. But for telemarketing calls, anything involving the sale of a good or service, you must have this e-sign compliant written consent. And there's some fine print in here that makes compliance a little tricky, in that consumers need to be told that they don't have to agree to receive auto-dialed or pre-recorded calls in order to get the product or service that's on offer. There are some particular rules about the scope of consent in the healthcare context, and some free-to-end user call exemptions. And so I'm going to turn it over to Mark to talk about those.
Thanks, Becky. As Becky mentioned, consent is an important issue, and frankly, I think for all of us in this space, you really don't have a better opportunity to establish the consent that you want to rely on than when you have your first interactions with the patient or the member or subscriber. So as early as possible, and then you have the opportunity to keep the information up to date. We're going to go through the healthcare specific consent issues quickly, but then we'll save some time for Q&A at the end. As Becky mentioned, in some contexts, the provision of a telephone number to the caller without any other disclosures is going to be sufficient for non-marketing calls, including non-marketing auto-dialed or pre-recorded calls. Context matters, and certainly the emerging best practice to avoid TCPA litigation is to provide a series of express disclosures when you obtain the telephone number that cover your ability to place a variety of auto-dialed and pre-recorded calls. Even if you're not subject to the written consent requirements for the marketing side, we really have seen a push by the plaintiffs' bar in recent years to pressure callers to have express disclosures about their TCPA consents. The FCC had previously clarified, as noted, that the provision of the number can be sufficient, but there were a number of questions that have come up in the healthcare space, specifically when you think about the HIPAA ecosystem and the use of multiple covered entities, business associates, and others. And what the FCC said is, look, if a consumer provides his or her telephone number to a healthcare provider, that is prior express consent without any necessary disclosures to the side for certain calls that deliver a healthcare message under the HIPAA privacy rule. The FCC didn't define healthcare provider, but note that they didn't say providing the phone number to any covered entity. What they said is if you provide it to a healthcare provider, then that healthcare provider can share the number and the consent through the HIPAA ecosystem for calls that deliver a healthcare message under the HIPAA privacy rule. So, for example, if you are an insurance plan, it's not clear that you qualify as a healthcare provider. And again, if you look, it's the healthcare provider that has to receive the phone number from the consumer. So that's the point of entry. So if I give my phone number to my doctor can share the phone number with a hospital or a specialist that may need to call me before I arrive on site. But also, this is only consent, again, without express disclosures. If you have express disclosures, you can structure the consent as you like. But absent express disclosures, it's only going to give you consent for healthcare messages as defined under the HIPAA privacy rule. It's not healthcare operations, so payment, billing, administrative. A number of those other categories aren't squarely under the HIPAA privacy rule healthcare definition. And then also, to the extent you want to place calls outside of the HIPAA healthcare definition, privacy rule again, you should look to make express disclosures. The FCC also clarified that if we're talking about an incapacitated patient, they can have a proxy provide the consent. But once the patient is no longer incapacitated, that proxy consent expires. So once the patient is able to consent in their own right, you need to get that separate consent. Going to the next slide, the FCC tried to strike a balance, and this is the healthcare, the free to end user exemption for certain healthcare treatment calls. The FCC was trying to address the need for certain urgent, time-sensitive healthcare calls that parties had demonstrated in the record were important from a public policy perspective, and also contributed to member satisfaction and overall healthcare improvement. And the FCC said that if you place calls or text messages that are free to the end user, so you have to work out an arrangement with the wireless carrier to pay them for the calls or text messages. So no reduction in minutes, no charges to the consumer, no change in the bucket that they have available, no negative impact from a cost perspective or service plan. You can place certain healthcare treatment calls for which there is exigency and have the healthcare purpose. This is not an exemption for all HIPAA healthcare messages. Instead, there are specific categories of calls. We've listed them on the slide, and there may be some other areas, but don't confuse this with applying to all of the calls that deliver a healthcare message under HIPAA. This is an exemption going forward. Calls must be free to the end user, and only if they qualify under these specified categories. Going to the next slide. The calls are not exempt if there's any telemarketing, solicitation, or advertising content, and no accounting, billing, debt collection, or other financial contact. And as I mentioned, the recipient cannot be charged when the voice call or text message is made or sent to a wireless number. And one of the benefits for for these exemptions, and this is similar to the financial services exemption that I mentioned for data breach, is that it does help you avoid some of the potential litigation risks with consent, revocation of consent, and reassigned numbers. So on slide 16, these are the other conditions that you have to follow. So I mentioned that they have to be free to the end user. You have to comply with the HIPAA privacy rules for the content. You can only send to the wireless telephone number provided by the patient. Certain disclosures have to be made. The text messages or calls have to be limited in duration. And there are limits on the number of messages. The limit for the healthcare exemption is up to a set of 3 messages per week from a particular provider. And you must also include an opt-out to allow the consumer the right to stop receiving the messages. And we'll have some time for Q&A at the end on other issues, but I think that gives us a good overview of the state of the law out there today.
Thanks. It's very complex, so questions and answers will definitely be welcome, I think. Okay, I am going to turn this back over to Adam to talk about some of the industry challenges.
Thanks, Becky. Thanks, Mark. Really appreciate the overview and detail that you guys provided. As we said, we will provide time for Q&A. I've already seen a number of great questions coming in, so we'll want to carve out some time. So in the interest of that, I will move fairly quickly through the challenges and best ways to address and respond to TCPA. So when we're getting started with our clients and prospects in the conversation, some very common questions come up, and they're all related back to the topics that Becky and Mark were talking about. Questions like, what percentage of phone numbers are landline versus wireless is sort of a primary question that needs to be answered in the waterfall of logic before dialing. The whole topic of consent that Mark ran through is really important, not only from a capture perspective, how am I capturing it, am I doing it the right way, but also storing and maintaining it, because obviously things change for a variety of reasons, and having the most up-to-date information is obviously critical. The topic of reassignment is really, really important, and it's a slippery slope for a lot of our clients. So even being able to help them to understand what percentage of phone numbers that they believe to be still attached to the consumers that they're trying to reach, where they believe that the consent is still valid, oftentimes we find that that's actually not true. That consent, the number's been reassigned, and therefore the consent has been broken. Then it boils down to the overall dialing strategies themselves. What techniques are being used? Is my dialing system classified as an auto dialer or not? Are texts involved? Are those texts free to end user or not? Do they fall under some of the exemptions that were discussed earlier or not? And then how are phone calls where consent is not valid on wireless phones, how are those being treated? And then one of the biggest questions that we get from our clients is around how frequently should they be monitoring for reassigned phones and also for phone numbers that are ported from landline to wireless. Becky mentioned earlier that in densely populated urban areas, phone numbers are being recycled much more quickly. Prepaid wireless phones, similarly, are being reassigned very, very quickly. So the common rule of thumb that the industry has largely adopted of every 30 days scrubbing to make sure that ownership is still valid is even eroding a little bit because of those special cases that get reassigned so quickly. So these are the questions that we're helping our clients to work through and to understand so that they can move forward confidently with the right strategies. A real good way to just think about the best practices in general can boil down into these 4 categories that you see on the slide right now. Obviously, capturing, storing, and maintaining proper consent is critically important when dealing with wireless phones, particularly, of course, auto-dialing wireless phones. Secondly, understanding your dialing practices. Am I using an auto-dialer or not, and am I using it appropriately? Third piece is really identifying the phone type, and the key here really is to understand the current phone type. Just like called party versus intended party that was discussed earlier, it doesn't really matter what you thought the phone number was. It matters what the phone number actually is. Is it a wireless phone? Is it a landline phone? And really importantly, understanding that if you're using disconnect data to answer that question. I'm sorry, if you're looking at porting data, understanding the difference between a disconnect and whether a phone number has just ported from carrier to carrier, where in that scenario it could actually still be valid consent. That's an important distinction in understanding the phone type itself. And then lastly, and arguably the place where our clients struggle the most, and one of the primary reasons they come to us, is to confirm the current subscriber, the current owner of that phone number, to ensure that there hasn't been reassignment, and to make sure that that's happening frequently enough to avoid operating on old data. So let's talk a little bit about Neustar itself and how we're operating in the landscape, and then ultimately we'll move to a brief case study. So we're here today, and you guys are here today because you want to learn more about TCPA, and because we want to be able to share how we're helping some of the largest corporations in North America to help deal with TCPA compliance. We power the majority of the strategies around TCPA and operational efficiencies for the largest financial services corporations, collections agencies, healthcare, and you see a variety of others in here. The fact of the matter is there really aren't any industries that are immune from TCPA. Anybody that's doing auto dialing would fall under the purview. Financial services and others have been hit pretty hard. So they're the ones that have paid the most attention to it, and I think that certainly healthcare and others are unfortunately rapidly catching up because the scope has certainly spread. So a quick bit about Neustar itself. We live in the middle of and power a lot of the telecommunications industry and have done so for several decades now. Many of you would be interested to know that we power about 80% of all U.S. caller ID in the nation. So over 4 billion phone calls every single day are connected, and the telcos are contacting Neustar in real time to find out what name to display on the caller ID box or phone every time a phone call is connected. So that's the sort of relationship that we have with telcos and the accuracy of the data that we have to power caller ID as well as directory assistance. We facilitate providing port data and other market share analytics to telcos. So we are a trusted partner of the telecommunications industry to drive it and to make sure that identity and accurately at all times. In addition to just facilitating, not just, but facilitating the infrastructure itself, we're also answering hundreds of millions of queries from other companies to verify information, whether it's for TCPA purposes or fraud or lead generation or other purposes. And of course, we're helping the largest corporations in America to manage their TCPA risk. At the end of the day, we have to get it right, or caller ID wouldn't work, or in a lot of these other responsibilities wouldn't work either. So let's talk a little bit about how our verification solutions operate. We've designed the verification for TCPA solutions specifically to address the key points within the TCPA regulations to make sure that all of those checkboxes that we talked about earlier, we're providing insights on each one of them. So the way the solution works is we will receive from our clients a input such as a name, a phone number, and a consent date, or a last right party contact date, and we bring it back into our repository that's being updated and refreshed every single day continuously based on authoritative data sources so that we can help our clients to understand if the phone number and the name are still linked, to understand the current phone type, the outbound dialing activity level on that phone, whether or not it's a prepaid wireless phone, and then one of the most important pieces is tied back to that consent date that was provided. Have we seen disconnect activity since then? Meaning, is it being reported as having disconnected since then? And correcting for the difference between a true disconnect, where service has been disconnected and now that number is going to be reassigned to somebody else, and distinguishing between that and where the phone number has simply ported from one carrier to another carrier, but the same consumer still owns it. On top of that, our clients will layer different business rules and processes and the like to overall drive their business strategy. I'll spin through this one quickly. There's 3 main delivery options for our insights. We have real-time options where single queries are sent and responded to in real time, similar to the caller ID example. batch queries that a lot of our clients have used historically, where they'll send us a list of phone numbers and names and consent dates for numbers they want to dial the next day. We score, append, and return them through a secure FTP. And then lastly, and the latest evolution is proactive change notification, where we actually onboard our clients' data stored in a secure location, and we monitor that information for changes against our repository. So as new feeds are coming in, as we're finding triggers like the phone type has changed from a landline to a wireless phone, or the ownership on that phone has changed, we're then able to push the updates to our clients so that they can make the appropriate adjustments in their dialing strategies. Increasingly, proactive change is the way that the industry is looking to go for two main reasons. It reduces the amount of data that's transferring back and forth, and it reduces the amount of latency in the data. For instance, if you're checking your data every 30 days, you then have the risk of 29, 30 days worth of stale data that you're looking at, whereas proactive change notifies you every single day. So let's go through a real quick healthcare services case study so you can see how these solutions operate in practice. So what I'm showing you now is an analysis that we did with a healthcare company. This is the way we get started with a lot of our clients, just so you know. So we will take an input file of records that they have either recently dialed or are getting ready to dial. In this case, our client provided us with a unique ID just for tracking purposes, a name, an address, and a phone number. They did not include a consent date, but that also could be an input that is included. And we'll do some quick stats like you see on this slide. What's the current landline wireless split? In this case, it was roughly 55-45. What percent is prepaid, and so forth. As I mentioned earlier, we take those inputs, we bump them against our repository, and we output a variety of different data elements. But the main ones that we're going to want to look at for TCPA purposes are the result codes themselves. I'm not going to go through all of these. You will have access to the entire deck. But what we do and what you can see here is this is not simply a binary yes-no. Does the phone number belong to the person or not? We provide more granular level of information according to the strength of the sources. Are they authoritative data sources, like carriers or other data providers that have direct relationships associated with that phone number? All the way down to other corroborating data sources. The highest scoring code is a 10, where the authoritative data sources is verifying that that name and phone number go together, all the way down to category 1, which is that red section at the bottom, where we say the name and phone number are authoritatively mismatched. Furthermore, it's a consumer phone number, so that means that the consumer name on that record does not match the one that you think it should. We also have category 2, which is a very risky one. This is where the phone service has been disconnected since the consent date. So what you see on the next slide is a breakdown of how that file distributed across the different categories. And just quickly, you can see that 68% of the wireless, this is just the wireless phones, by the way, 68% of the wireless phones were either a code 10 or 7, meaning that they're linked or authoritatively linked. We have code 2. In this case, we used a somewhat arbitrary 6-month back date just for illustrative purposes. And we have code 1. So a total of 9% of the phone numbers, the wireless phone numbers, fell into that high-risk category where the phone number was mismatched or there was a discontinuation date within a recent period of time. This slide breaks it out to show wireless versus landline and then compare it to all phones just so you can get a full view. And then we can layer on other insights. And this is one that's particularly powerful. This is speaking to the level of outbound dialing activity on a phone number. This is fairly unique data that Neustar has and helps you to understand how frequently that phone number is making those outbound dials and the consistency of it. So what you can see is up to 12 consecutive months of dialing activity all the way down to 12 months of consecutive inactivity on a phone number. This speaks really to the accuracy and the usefulness in dialing that phone number at all. If, for instance, you are trying to reach a consumer and they haven't made an outbound dial on the phone number you're trying to dial them on in over a year, your likelihood of reaching them is very, very low. This is particularly helpful in a manual dialing environment. So if you've identified that phone numbers are mismatched or there's been a discontinuation, you're going to manually dial the numbers. Knowing which phone number you have that is the most actively used is a very valuable insight. And then oftentimes we'll bring these together to help our clients to understand how they're file distributes across, and to help inform how the industry is approaching that. So what you see here is an example of the activity level down the side and the verification scores across the top. Remember, the higher the number of the verification, the more authoritatively linked they are. This is an example of how one of our clients made their decisions to split it up, where they said codes 1 and 2 are really bad, we're going to cut them out. The green ones are the highly active, most highly verified, and the yellows fall somewhere in between. And what we've seen from other analyses we've done with many, many different clients across industries, if you look at the table in the lower right, you see significantly higher success in right party contact rates when it's a highly active, highly verified phone number than when it's in the red category. And this is really important from a business perspective, because what this helps you understand is, what is my business trade-off if I'm carving these high-risk phone numbers out of my dialing practices? As you can see, the red category makes up just under 9% of the population, and but only represents, it heavily under-indexes. It's 1/5 of the right party contact rate of the average, and significantly, significantly lower than the right party contact rate in the green category. So I'll wrap it up here, and then we'll go into the Q&A section itself. I just want to hit you with a couple of key points. Best practices, as we've seen, as being a leading provider of TCPA insights for the industry. Most important, using authoritative and accurate phone intelligence, updated as frequently as possible. Verifying ownership, reassignments, and phone type, and within that, distinguishing between reassignments and porting. Leveraging phone activity to help you make even better decisions around your dialing efforts. Prioritize the best numbers, cut out the bad numbers, and more importantly than anything, deal with this head on. We have clients that are struggling a little bit with the strategy, and that's letting time pass. The more time that passes without the right strategy in place, the more exposed you are to TCPA. So with that, let me pass it back over to the moderator, and we'll go to the Q&A session.
Great, thank you, Adam. As he said, it's time for the Q&A. We have a lot of great questions. We'll try to get to as many as possible. Our first question, complicated one here. Would any reasonable means, quote unquote, include alternatives to revoke consent, such as revocation through a voice conversation with a customer service, or a chat box, or email to a generic company email?
Potentially, yes. The FCC did not go into the specifics on reasonableness. They did give examples of in-store retail locations and certain. There were some other website-related examples. It really depends. What I think you should be thinking about from a compliance perspective is if it's otherwise easy for the patient or the individual to communicate with you through a particular channel because you've established that channel for communications, you would have a more difficult time limiting the consent right through that channel. So, for example, you have an email, a customer service email box or phone number or so forth, you should expect that the plaintiff's bar will want you to make the opt-out available through the channels that you're reaching out to consumers through. So it just depends. Chat box, I think, is difficult, but it really does speak to how the burden here is on the caller. So if you are trying to communicate with users through different platforms, you really should think about making consent revocation processes through all of the channels.
Great, thank you. Another quick one. Is it correct that auto dial calls are specific to voice-activated messages, not a live person?
So I just sent a note in on that one. The answer turns on what the capacity of the equipment is. So even if you have a situation where there's actually a live person sitting on the line waiting for somebody to dial, it can still be subject to the TCPA limitations on the use of automatic telephone dialing systems. The answer turns on the capacity of the system. So if the system, could dial random or sequential numbers, it's going to be covered whether you route to an operator when the call is answered or there's a live person sitting on the phone waiting for somebody to answer.
Yeah, the wireless restriction, for example, references both auto-dialed calls and pre-recorded calls. So don't associate an auto-dialer with the robot voice. That's what we think of as a pre-recorded voice call. Auto-dialer is the equipment that you may use even when there's a live rep in connection with the call.
Great. Thank you both. Can you expand at all on the exception for healthcare calls?
And on this one, the question came in before we covered the healthcare exemption, but happy to deal with any other questions afterwards on that.
Gotcha. Sure. And what exactly does it mean to misdial a phone, and what are the implications of that?
Well, misdialing is not something that's protected under any of the pieces we discussed today. There is that one call attempt exemption to liability for calls to a reassigned number, but even for that, the FCC clarified it wasn't trying to give a one call pass to a misdialed number. You as the caller have the obligation to make sure that the numbers you dial are the ones you intend to dial and the numbers that you have for which you have consent. So for misdialing, there's not protection.
That clarifies it. What are your thoughts on the one-call exception? And can you tell me a little bit about how companies...
Well, this is one of the areas where it's really important to make sure you're protecting yourself, including through the use of third-party resources, because you may never know when you've placed that first call. Part of the problem with the reassigned numbers issue is that you don't know until somebody tells you that the number's been reassigned if you rely solely on the calling. So third-party services can be very helpful here.
Okay, thanks. Can you talk a little bit about some of the nuances and the differences in the law as they apply to healthcare?
Well, I think in light of the 2015 decision, you've got at least three different areas to be considering. The first is, what if a healthcare provider gets consent and then needs to share it through the HIPAA ecosystem for healthcare calls under the HIPAA privacy rule. That, the FCC clarified, there is consent. Context matters, and make sure that the calls are somehow related. The phrase they use is closely related, but context matters, closely related to the purpose for which the consent was given. You also have a scenario of what if it is a telephone number provided to a healthcare provider, but it's not but the calls being placed fall outside of that, and that's a somewhat murky area now. But there's prior FCC guidance that suggests that if you give your number to your doctor, even absent some other disclosures, that specific doctor should be able to call you for payment and other non-healthcare specific issues. And so there's clarifications, but it's very complex as to which set of defensive arguments you would have on consent. And that's why for the healthcare context, you really want to be making express disclosures. Otherwise, you're going to have a much more difficult time on the litigation front. And then for going forward use cases, you could rely on the free to end user exemption for healthcare treatment calls.
Can you tell me what was considered express written consent, and can this be provided online? Can verbal consent be provided to the CSR?
So express written consent means consent that is written in compliance with the requirements for e-sign. So a voice recording definitely qualifies. Obviously, you have to be able to store and reproduce that recording. Other tangible evidence that the person has consented is what you need.
Great. And looks like we might just have time for one last question. Can you tell me what the current status is of the suit that the ACA is bringing to challenge the declaratory ruling?
That one we covered briefly earlier, but it's still pending. Briefing is done. Oral arguments are still to be scheduled, and we expect a decision likely by August.
Great. All right. I want to thank everyone for attending this Fierce Live webinar and submitting so many great questions. I'd also like to thank our speakers for participating and Neustar for presenting today's webinar. This webinar has been recorded. You'll be able to access the recording within 24 hours on the same page you used to register for the event. Thanks again for joining, and we look forward to seeing you at future events. Hello, everyone, and welcome to Reducing TCPA Risk in Outbound Healthcare Communications, presented by Neustar. I'm Leslie Small, editor of Fierce Health Pyre, and I'll be moderating this webinar. Our speakers today are Becky Burr, Chief Privacy Officer and Deputy General Counsel for Neustar, Mark Brennan, a partner at Hogan Lovells LLP, and Adam Russell, Executive Director of Compliance Risk and Fraud for Neustar. You can read their full bio